Certainly the most uncertain and unpredictable back-to-school season most of us have ever experienced. The looming COVID-19 pandemic is affecting the start of the school year for districts all over Texas, but not every school has the same set of rules. For more on that, plus headlines this week in the state of Texas, let's send it over to our Sally Hernandez along with Alana Rocha with the Texas Tribune.
Alana, we've been talking a lot about reopening public schools, but what about private schools? What do they have to consider here?
Lawsuits. Obviously they're taking the children's health into consideration and, seeing drops in enrollment or themselves limiting enrollment to ensure kids and teachers can social distance. But of course, limiting enrollment means limiting that revenue coming in and again, having to spend to make sure that the kids and teachers are safe because unlike their public counterparts, they are subjects to lawsuits and vulnerable to that. But they are getting federal help as well. There's a sizable chunk of change in the CARES Act for them. Here in Texas, it amounts to $40+ million. So even though enrollment statewide with nearly 1,000 or so, I believe, public or private school institutions in the state, they will get some federal help.
Okay. Governor Abbott and state health officials facing a lawsuit from about 5 very conservative lawmakers about contract involving COVID-19 tracking. Why did the lawmakers even file that lawsuit to begin with?
They argue, in the Texas Constitution, there's a separation of powers that leaves policymaking to the legislature and that the governor should have called lawmakers back for a special session. Further, they argue that this process of awarding the contract wasn't done properly, that there wasn't proper, bidding put out to have different companies issue bids. In response, we didn't get a response from MTX, the company in question here. The governor's office nor didn't respond, but we do know that the governor's office has defended this contract in the past, saying they have done similar work in other states and that these are federal funds that paid for the contract, not state dollars.
When it comes to COVID-19 and all of the information, the data that we get, we see it every single day, Alana, right? The state spits it out. The magazine, The Atlantic, gave Texas an A for the quality of this work. Why did they do that?
Transparency, mainly, and that they're the state's up front when it makes an error or recalculates something. Just last week it had to issue 2 corrections on its tally of people who have died from COVID-19. But yeah, even in the best circumstances, this data is an undercount of what we're seeing as far as the spread of COVID-19. Several factors. This is a first-time virus we're dealing with, so you have changing technologies, changing discoveries in the science, bureaucratic changes, how things are reported, how things are counted. And so despite all that, state health officials say it does guide policy and does give kind of good big picture trends to show how well we're fighting this or not.
Alana Rocha with the Texas Tribune. Thanks for joining us on this Thursday.